The next session is about the warm handoff. And somebody said, where you get warm handoff from? I don't know. I like warm stuff. I don't like cold stuff. I'm warm. So we want to know how you can hand off your interaction with an employee to DC HealthLink. And so we're going to talk about that process. We have a few small group, a small group exercise for you to do, some scenarios, and then we'll make sure that you understand and ask any questions. Let me turn it, oh, there's Danica. Here she is.
All right, everyone, we're going to get started on going over the warm handoff process. So first we have my beautiful face with a smile. Can I see some of y'all smiles? Okay, this is how we're going to go to the doors with warm smiles. So we'll go ahead and discuss the process of you all just getting the employees or the directors from pretty much just being educated by you all to signing up for an appointment. I look at it like fishing. You may be calling all day and not receive an answer. You may go to some sites and they may not answer the door. But when you do have someone who bites onto the bait, we want to schedule them an appointment. If they're too busy, no worries. Let's just get you scheduled an appointment. If they have time, we'll discuss it with them and then schedule an appointment. But our end goal is to schedule an appointment. So that's what we're going to just go over. 15 minutes looking at the scheduling process. Okay. So this is a QR code for the Healthcare for Childcare appointment tool. We use a website called SetMore. And so the website is healthcareforchildcare.setmore.com. And again, the QR code, who's familiar with QR codes? Okay. Okay, y'all real young. That's what I like to see. So what I do is you'll have a handout that has the QR code. We can leave it there. If someone's skeptical, just say, hey, here's the QR code. If you scan this with your camera, you'll have the link to schedule an appointment. So I also just keep this on my phone. Sometimes I'll just hold up my phone. If you don't trust me, just schedule an appointment yourself. Sometimes that happens. It may not happen with you all because y'all are familiar with the community. So next, what happens once you actually select the link to schedule an appointment? It's going to ask you to choose your service. So we have two. We have Healthcare for Childcare Centers, and then we have Healthcare for Childcare DC Residents. Why do we have two separate links? Can we get the mic? Second mic? It's in your pocket. Where was it? So, oh, here we are. And can you state your name when you grab the mic? I want to make sure I'm familiar with you all.
My name is Ian.
Ian.
So I would say the child care center one is for the shop market, and then the DC Res one is for individuals.
Exactly.
But only DC residentials, non-people from other states.
Exactly. Can I get a round of applause? You've been listening all day. So yes, we have, oh, she's like, I still have the mic. Is it two? Oh, we have three, okay. So yes, we have two links to schedule an appointment. Healthcare for Childcare Centers is for our directors or whomever makes decisions on behalf of the childcare center or home. And then the second link is for our DC residents enrolling in the individual and family market. Okay, yes.
A suggestion that I have is for we don't just have centers, maybe it makes it longer, but put family homes, because too often the family homes are not identified specifically, and that does not make family homes happy.
So are you referring to the home providers? So the reason we have it separate is because majority of the home providers fall under the DC resident category because they don't have any non-DC resident employees. So
is there a way to put a disclaimer on the page that says something to that nature that just, I think it's important to recognize people.
So we can, okay. Thank you.
Because family homes do have more than just the owner.
Yeah.
Yes, but in our experience, they tend to only have DC resident employees. But yes,
Yeah.
I hear what you're saying. Because if a home-based provider had non-DC employees, you're right. The link you would want to click is the top one that says centers, but you're not at a center. You're at an expanded home, right? So I hear what you're saying. You want homes to be represented. The problem is that they fall into both of those categories. right? If you're a home provider, but you have an employee who lives in Maryland or Virginia, you actually need to go to the small group team. We'll think on this. I take your feedback. We're going to come up with something. I hear what you're saying. Home, you need home to be presented here, and in our mind, we're like, well, they're almost always residents, so let's just have them click there. But I hear what you're saying. We'll try and figure out something.
Thank you, Jen. Alrighty, so we can move to the next slide. So once you choose the service, the next thing you'll do is choose your provider. There are different providers based on the service you select. So if you select Healthcare for Child Care DC Residents, you'll see my name and Indian Anderson. You'll also see here that it's in English and Spanish. We notice that a large population that we work with is Spanish speakers, and we let them know language interpretation is available. So English and Spanish, so regardless of who you work with, you will be able to be assisted in your preferred language. Oh, sorry, can we go back? Go back one more, okay. And then on the left side, we have our small business specialist. So we have Fumi Hall, she's in the back. Hey, Fumi. Then we have Christian Naro, he's our supervisor. He is currently on vacation. We have Brian Swartz, not here today. And then we have Kelly. Hey, Kelly. So these are some of the specialists you'll be working with in scheduling appointments. We can move through. Alrighty, so now we have chosen our service, chosen our provider. Now all we need to do is determine the best time and date for our director or employee. You'll just select the date. So you have the option to select the date. The dates that are available are going to be highlighted blue. If it's grayed out, it's unavailable. Once you select the date, the time slots will then appear. Then we'll select a time slot, whichever is best for your client. And then on the next slide, we'll enter their information. So the required information is name, phone number, email. You can leave comments as you find necessary. Some people may say, oh, I have Medicaid, or I already have coverage. Whatever is necessary, they can leave little comments. We don't recommend leaving any protected health information or private information there. They can enter their preferred language. It's not required, but if someone does have a language preference, definitely put it in there so that we can use the language line solution. In our newer sections, OEP grantee, yes or no. If you work with someone to schedule an appointment, you want to select yes to this option. If you leave your card with someone and they say, I'm going to schedule on my own, you want to make sure you let them know which OEP grantee you are so that they can come in and indicate your organization when they schedule. So, OEP grantee, yes or no, they should always put yes if you all are working with them. And then go a step further and let them know your organization. If, like, for example, Surge, they may not remember the full name, but you can give them the, is it called acronyms? Yeah, acronym. And so they can go ahead and put the OEP grantee name. It's optional because we are forgetful. So they may not remember, but if they put yes, we may be able to work with you all to kind of determine who they received outreach from. Any questions so far? Yes, one moment.
And just to confirm, this is like when we got somebody to say, yes, they're interested, and we'll set them up for an appointment with you all for the next steps of actually being enrolled.
Yep, exactly. So you all will educate and then schedule an appointment, hopefully. If someone's not available, you may not be able to educate, but we do want to push for an appointment so that someone else can educate them. Again, we know they're busy working with the children, so we want to be really flexible when assisting them. We can move on to the next slide. So once the appointment is scheduled, we'll see a confirmation page, or whoever scheduled the appointment, they'll see a confirmation page. It just says your service, date and time. There's a booking ID or a confirmation number. And then it says, here's the link to join your session. So they don't have to come in person. Many people say, I'm scheduling an appointment. I work all day. How can I come in person? Well, it's on Zoom. You can go to your car, go to the lunchroom, break room, and join your appointment. It's about 30 minutes. So, and if we go to the next slide, this last slide is just going to show you the email confirmation that they will receive once the appointment is scheduled. So let's see here. Okay, so it'll come to them as like a calendar invite. If they want to add it to their calendar, they can do so. They'll receive this email immediately, and they'll also receive a reminder 24 hours beforehand saying, hey, you have an appointment tomorrow. The Zoom link is here. They'll select join your meeting. And if they have any issues joining, they can use the booking ID. No, is it the booking ID? Oh, no, actually, I'm so sorry. They can only use the link to join because it's specific to them. So they can't share it with anyone. No one else outside of the person who scheduled the appointment can join. And if they're not able to attend their appointment, they can, they can reschedule. If they're not interested, they can cancel. If they have any coworkers or maybe it's a director who wants to schedule for their employees, they can select book new appointment. So they're not locked in. Just let them know, hey, we can just schedule you now. If you need to change it, you can log into your email and switch it out.
You just answered my question. I was going to ask about rescheduling appointments. But you said 30 minutes, so 30 minutes is like the minimum of time they'll be in the appointment. Could it be longer if they have other things? Okay.
I was just about to say that. So we say 30 minutes is the minimum. If it's a DC resident, that process is longer. It can take up to 2 hours for the application. So DC residents, they go through a different enrollment route and process. There's way more requirements and breakdowns and applications. Whereas for a non-DC resident employee or someone who is in that continuing coverage program, all we need is their name, gender, address, and if they have a social, and date of birth, of course, and then they can just enroll. But with DC residents, we look at income, immigration status, household. It's just a lot. Yeah. So it's it can take up to 2 hours for DC residents. So we
Sitting on the phone for 2 hours as you do the application?
Yeah, we work with them to complete the application on Zoom. So we'll share our screen. Well, the enrollment assistants will share their screen and go through the process. It's the same as if they were to call our contact center and whatnot. The process can take long. It just depends on how many members are in their household.
Yeah, so Kathy, sometimes you may have 7 members in your household and don't know all the social security numbers. Then you gotta wait for them to go look for the social security numbers, come back to the phone. That's up to, yeah.
Okay,
Yeah.
so is there prep for the appointment? Is there a checklist so they
Yes.
can say, oh,
The
okay.
step card that I
Yes.
showed you earlier,
Okay, it's there.
it has that information, what they should bring to the enrollment process. But a lot of our people
Yeah.
don't read all of what we need to have, and so we are so kind, we just wait for them to go get it.
Yeah.
The idea is to get them enrolled. We want to
Yeah.
get them enrolled. Once we touch them, we don't want to let them go. We want to get them enrolled. So it could take up to 2 hours, depending on what information they have, income, knowing what the income, all of that.
Have everything, yeah.
I said this, but I just want to emphasize it again. This is for the individual and family marketplace. And the reason why it takes forever is it's a federal program, right? Where like you are who you say you are, you live where you say you live, you make what you say you make. All that has to happen. In the small group employer market, it's pretty much the employer says, Dr. Wharton Boyd works for me. Then we go over there and say, what's your address?
Yeah.
How old are you? What's your soch? That would be helpful. Don't have to have it. Exactly. And then we choo-choo-choo. So it's easy to sign up employees from the employer-sponsored market, but when you're buying on your own, it's the longer process.
Yeah. I mean, in the majority of our enrollments, they are shop. So.
And one other thing which we might get to, but you know, we have been pleasantly surprised. Most of our childcare workers are pretty technologically savvy because the workforce is all over the place in terms of age, but there are a lot of young workers. If we find a childcare center or home where they're challenged, Zoom is not their first place, we can always have someone show up. We can go there in person.
Definitely. So yeah, we do, you know, if you ask someone their preferred outreach method, if they prefer Zoom or if they prefer we come in person, we do site visits specifically to enroll employees and also assist the directors with setting up their benefits. So that is available. Okay. Oh, yeah.
Sorry. Just to make sure, for DC residents, you said they need to prove of income. So, but is there any scale of eligibility,
Yes.
or like a minimum family size, like the other programs work here?
Yes, so that is a great question. So for DC residents, their income has to be over the 2023 threshold for Medicaid. I don't know it off the top of my head because it's different based on household size. But if a DC resident is found eligible for Medicaid through the application process, they will continue coverage through Medicaid because it's free, comprehensive health, dental, and vision coverage. So that is one of the eligibility criteria.
We never want to talk someone out of Medicaid. We should have mentioned this earlier. We encounter people all the time who have Medicaid, and sometimes they say, I want this, because they think, ooh, care first, I could go to any doctor I want to. No, they need to stay on Medicaid because they have to. But even if we did switch them, they would encounter co-payments and things that are nothing like Medicaid. So if they are eligible income-wise for Medicaid, they're going to stay there. And we
Yeah.
want them to have the best coverage possible.
Yes. And so what I do tell them is if your income changes, you can report an income change for redetermination. So that is available to them. But to answer your question, yes. So that was a great question. The only blockers for DC residents enrolling in the individual and families marketplace is Medicare, Medicaid, and if you're already enrolling under continuing coverage. So if they're already enrolling under that SHOP continuing coverage option, they can't come to the individual and family side.
We do get a lot of questions from people who are on Medicare because they want wraparound coverage. We can't enroll them. If they already have a private insurance plan and Medicare, they can stay on it, but we can't newly enroll someone who has Medicare. You will get that question. We get it pretty regularly.
Did it go out? Oh. And then, again, those restrictions do not apply to the SHOP side, Medicaid or Medicare. They have no stipulations. Just be an employee, you're eligible, as long as you're living outside of DC, or if the group is continuing coverage.
Great. I had two questions for you, but then Jen mentioned something I just wanted to clarify. So if they are on Medicare and we all want them to stay there, that person is no longer on that list that you were giving us, right, of who to contact. They've been taken out?
Correct.
Good.
Correct.
Okay, good. And then my question to you is twofold, or two questions. If the goal is to get them to create an appointment to enroll, is there an opportunity, you can also make an appointment for you guys to convince them that perhaps this may be a better option, or at least educate them, so there could be two, right? And then if you could also walk me through, like, what would an appointment look like for somebody who didn't speak English or limited English proficiency?
Yes, so for someone who doesn't speak English, we'll either conference in one of our Spanish-speaking colleagues, and they'll interpret. If not, what I do is I get on Zoom, and I call the language line and call the consumer on three-way, and we do a three-way call, and I still share my screen with them, so we can still see face-to-face. So the interpreter will be on the line, interpreting everything that I say to the consumer, and vice versa.
Can I go back to Teresa's first question, which was the appointment? Can you make an appointment just for them to learn or can be convinced? That's all the appointment. Every appointment here, like almost nobody makes an appointment and enrolls the first time. Making the appointment, the whole goal of the appointment is us to start talking through what do you have right now, this is another option, or compare, maybe they have nothing. That's a little bit uncommon, but sometimes that happens, right? So it is multiple appointments, frankly, because almost always that first appointment is show me.
Education.
What is this? How much does this cost? What happens if this situation? What should I think about in terms of deciding a plan?
Yep, and consumers like to go back and discuss with their families as well. And it's just keep in mind we have a pretty much an open door policy. So our goal is to ensure everyone, or at least educate them. So if they have a question about Medicaid or Alliance or Immigrant Children's Program, you can still schedule them an appointment, and we'll work our best to assist them as well.
Danica, I just wanted to add, because I felt your trepidation at the idea of a 2-hour appointment. And I feel that. And that's what it actually takes to enroll, but we will stay on the line with you for those 2 hours and walk you through it. So I just want to make clear that we are going to be there for every step of the process, whether it's multiple appointments or whether it is a 2-hour-long appointment.
Yep. I've had appointments where I'll sit there, I'll discuss the entire program. We'll start an application, submit an application. I'll say, okay, so what plan would you like? Well, I'm not really too sure. I like to look over the summary of benefits and coverage and compare it with my husband. So those are common. We get those a lot. And what I do is I'll just schedule them another appointment, or we have this system where we can track our progress and outreach to consumers. We keep it open all the way until we have determined that they have coverage through us or elsewhere. So we just try to make sure everyone's covered and know their options. Even if they're not enrolling in healthcare for childcare, we go the extra mile. Any questions? Yeah, come on. Yeah. So yes and no. So we have two marketplaces, SHOP and IVL. For SHOP, the business has to employ 50 or fewer in order to. Correction. In the Healthcare for Child Care program, employers have to employ 100 employees or fewer in order to come through the SHOP side. However, that doesn't apply to the individual and family marketplace. So we can take their DC residents and enroll them and their families in the $0 premium health insurance through the individual and family market. Now, those non-DC residents, we'd recommend them to maintain coverage through their employer or speak with their state exchange.
It's 100 full-time equivalents. So they could have more than 100, but if they're, 50 of them are half-time,
Yeah, schedule an appointment. Because to calculate equivalents, we have to calculate the part-times and stuff.
On the target list that we gave you all, remember we gave you a target list, the first tab is the center-based providers. Those all fall into SHOP eligible. Second tab, home-based providers, all of them eligible. Third tab, large employers. There's a handful of them, but they employ a lot of people. That's on the third tab. And those of you who raised your hand and said, I will try to reach out to either that employer or the employees there, you know who you are, you know what you're talking about when you're talking about them. It's like Centronia, a few others, UPO.
Maybe I missed it.
We don't have it.
And we have another question. Did you want to?
Well, mine is actually a comment to clarify my own thinking. Our job is to get you in the door.
Yes.
Yes.
Yes. Y'all are on the front line. Y'all are the faces. So that's why I like to see y'all beautiful smiles.
And Danica showed you at the beginning of the QR code, you're picking like this, remember we had that conversation, center would be SHOP or individual, if you're going to enroll them in the individual, it's for DC residents. Even if you screw up there, we're gonna straighten you out. Like we'll help you out. We'll make sure it gets fixed.
I just want to make sure that everybody understood what we meant by the full-time equivalent, right? Because I saw a little puzzle. So if a owner has 150 employees, and some of them are part-time, some of them are fourth-time, the equivalent has to be to 100. So it could be more than 100, but they're not all 100 full-time. There may be some may be part-time, some may be a third, three-quarters of a time. Long as all of that adds up to 100.
Under 100.
And thank you for clarifying what I was just mentioning, is that we're just receiving a lot bigger difference.
Oh, yeah.
And I'm so glad that we can now extend it to you, because that, at the end of the day, is, I just say, go to your director, and I know something offers it, but it can be out of pocket, and sometimes out of pocket is a benefit.
Yep.
So, that's just my, thank you.
Yep, and I've been noticing Centronia, I did a informational, 2 informationals with Centronia. We did one in English and one in Spanish. And then lately, their employees have been completing our web forms and also going into set more and scheduling appointments. So I know that the employees at Centronia are very interested. Some of them may have existing coverage, like Alliance. Are you familiar with Alliance coverage? So yeah, if they're eligible for Alliance, they can still enroll in the Healthcare for Childcare program, but it's really important that they understand that there are out-of-pocket expenses related to the private plan, similar to those people who are eligible for Medicaid, but they're saying, hey, I want the private plan. There's out-of-pocket expenses, so yeah. You're welcome. Any questions that we can answer?
So my worries about it is like on October, I think, for the pay equity fund, teachers will increase their salary. So I'm like, they will continue being eligible. Talking about the income proof of everything. So as you said, this program follows a federal law.
So you're wondering what happens to employees whose income changed due to the pay equity fund?
Yeah.
Didn't we just, okay, let's get Jen, Mrs. Policy.
Okay, so if someone's on Medicaid right now, let's say they're eligible for Medicaid because of their income, but they're going to get that pay equity subsidy and it's going to push their income up. You're right, we need to know about that. But we did something. We went to the Medicaid agency. You know, they are back. If you haven't heard about this yet, you will start hearing about it. Now that the COVID-19 public health emergency is ending, the Medicaid agency is going around and redetermining eligibility for everyone, right? We went to the Medicaid agency and we gave them the list we got who are DC residents that are entered into the OSSI system. So if OSSI knows that they exist and they're a DC resident, we went to the Medicaid agency and we said, please don't redetermine their eligibility until April of next year. Now that doesn't mean we've covered everybody. Somebody could have gotten hired in the meantime that's like new and we didn't get them. Maybe a facility didn't enter every single one of their district residents into the OSSI database, but we did tell the Medicaid agency, don't start redetermining eligibility for these workers that we just gave you until April of next year. So we're hoping that many of them will not encounter that situation, but if they do, the Medicaid agency is giving to our agency the people who lost Medicaid coverage, and we are doing outbound phone calls. Come in, you lost your coverage. Come in, we think you don't have coverage, we're gonna get you covered. Dueling microphones.
Thank you, Jen. And I also want to add to that, it extends to Alliance. So if anyone has Alliance, that's extended to April 30th of next year as well. Anyone who's receiving coverage through, Department of Human Services or ESA, Alliance, Immigrant Children Program, Medicaid, and then also qualified Medicare beneficiaries, although they don't qualify for the IVL individual market, their coverage has been extended as well.
I know we've discussed this, but we've discussed a whole lot, so I don't remember. But what is the time frame between notification of loss of losing benefits and you and DC Health, well, Healthcare for Childcare being able to pick those folks up?
We should be able to do it seamlessly.
Okay.
No one losing coverage. That's the ideal workflow.
Yeah.
Okay.
And we do get the names from Medicaid, so that's when we start reaching out. Medicaid will start reaching out to them before, when their redetermination date is coming ahead. So they will reach out to them.
Is it 60 or 90 days? It's one of the two.
Don't test me. 60 or 90 days. Let's say 60
Let's
days.
go with 60.
Let's go with 60. Yeah. I mean, yes, this is how it should work in theory, but we know real people with real lives, they've moved, they throw out the mail, they ignore the mail, they changed their something, right? But if everything were to work smoothly, yes. We will also help clean up when things don't move smoothly. So we will retroactively enroll them if they lost Medicaid coverage. We'll try to go back in time. We'll do whatever we can to try and make sure there's no bumps in coverage.
Yeah. And
Just as
for
a-
this, you can go ahead.
Just as a point of clarification about the pay equity, first of all, OSSI makes it voluntary, so everyone will not be in the pay equity program. And secondly, we are woefully under the attainment of credentials. We're only at 39% for lead teachers and for assistant teachers. So, I mean, the dimensions of pay equity, but the fact that it is voluntary does not make it equitable.
Thank you. I didn't know that. I wanted to add on, I forget what's his name?
Kathy.
Evan? What's that?
Kat?
I wanted to add regarding the time frames. So for consumers who lost their Medicaid effective May 31st, we were outreaching to them in May before coverage ended to say, hey, you need to renew. We can help you renew if you're sending your documents, or we can look at your eligibility and determine you're going to move out of Medicaid, so let's get you in private coverage. So we try to do it before they end coverage, but like Jen says, there's hiccups along the way with availability, with outreach. You know, those customers may not be available to answer and whatnot. So yeah, we try.
I'll also just note that's also a place where we're really hoping that you can help. If you run into anyone who is running into any of these issues, if they have expiring coverage, definitely get them an appointment. We're, of course, trying to reach out to them, but if you come across them first, please get them set up with an appointment.
Yep, open door
Goes
policy.
way beyond healthcare for childcare. It's healthcare, right?
Yeah.
So we're going to get them in one way or the other. We just so happen to have now, as Linda calls you, an army of people into the childcare world.
Yes, and I'm happy we have you all to join us on this journey. And do we have any? Did we have any other questions? Going once, going twice. All right, so let's get into the fun part. This is what Linda was saying is fun. If you have great interpersonal skills, then this is for you. We're going to break up into three sessions. Three sessions. 3 groups. Sorry, I just got braces, so excuse me. But we'll break up into 3 groups, and you'll be paired with a specialist. So one group will be with Fumi. Hey, girl. One group will be with Kelly. Hey. And then one group will be with myself. And we are going to discuss like the pros and cons of outreach. And we'll discuss the handoff process even further. How can you get someone who's not interested in scheduling an appointment to schedule an appointment? Sometimes they're just like, no. And you're like, well, what do I do now? So we'll talk to you more about that. And then we'd like for you all to come up with a role play scenario. So you pick 2 people from your group who's not a specialist, and the team comes up with the scenario. Maybe you're going to a home provider, someone's the provider, someone is the outreach specialist, which is you all. Maybe someone is a DC employee. Maybe we want to have someone who's Spanish speaking. So it's up to you all, have fun with it. And then, so Linda is going to do a count off, like 1, 2, 3, 1, 2, 3, to get you all in your groups.
Okay, we'll start at LaDon's table and do 1, 2, 3, 1, 2, 3.
1 second.
Uh-huh.
So I am going to, what are those called? Large sticky notes. I'm going to give each one of you your own, what is this called? Okay.
Flip chart. It's a flip chart.
I'm going to get each of you a poster board to use. On one sheet, you will add the pros and cons, maybe a line here, pros and cons. On the second sheet, we'd like to see your scenario written out. So just a scenario, you don't have to tell us what's going to happen. We want to see you all act that out.
And we'll bring these to you once we set up the groups.
Does it sound like a plan? Y'all don't seem excited.
Let's start off with your table, LaDon, on 1, 2, 3.
So a part-time employee doesn't equate as full-time. And I plan on us having a session on the website. It goes to the website, you plug it in.
Not saying that you are, but you know, communication and other things happen. I say alliance and then pick up the people.
Hi everyone, it's me again. So, my team is called a dream team, okay? We ready. We ready for our Oscar. So, we went over just pros and cons of outreach going in person or outreach over the phone. So a few things we came up with. Pros. In-person visit is beneficial because you're in their face. That's one thing. Sometimes they can't avoid you, although we know some people may not answer. Reliable. Why do we add reliable?
Reliable, trusted voices.
We have some reliable, trusted voices in person or on the phone to help them schedule an appointment and navigate through the process up until scheduling an appointment. Next, we have more engagement. On the phone, you can only call one person. You go in person to the site, we may be able to schedule 5 people an appointment. Or we may be able to get an enrollment specialist to come with you and actually do enrollments on the spot. So we're able to facilitate more engagement and get everyone involved. Or they'll see our faces and they're like, oh, who's that? What they came for? Word of mouth. So that's a benefit as well. Oh, a pro is that y'all will have identification and business cards so that I guess that creates more trust in addition to you all being trusted voices in the community. We are able to do storytelling. So when you're in person, you can do storytelling and tell the origin of how the Healthcare for Childcare came about, and even before Healthcare for Childcare, maybe discussing in Pay Equity Fund and how it came about offering the health insurance aspect of it, or benefit. So that's something you all can do in person. And you have the opportunity to hand off the consumers to knowledgeable enrollment specialists who you feel confident will take them to the finish line and get them all the information that they may have not been able to receive due to time limitations in person. Now, some cons. Okay, parking. Parking is a con. I said Metro. Some people, I used to take Metro, but now I'm a little more skeptical of Metro. I'm just scary Jerry, so Metro. Gas. That's our favorite word, huh? How many of us drive? Exactly. So why I didn't hear groans when I said gas? Gas is just too much. So that's a con as well. What about blank visits? Woo, I could have been eating. So when you go there, no one's there, or they're just really standoffish, you'll feel discouraged, and you can feel like it's a blank visit, waste of time. But I will say some people have turned us down in the beginning and came back once they heard more about the program. I hope y'all don't get shut down, and I don't see it. Y'all are wonderful. Y'all seem like really nice people, so hopefully y'all don't get that. Weather. So if you're not in a car, or even if you are, you may run into some rain. The heat, drink your water, keep some water on, y'all. Hopefully y'all can get some DC Health Link jugs. But yeah, the weather is a caveat all the time. And then, this is my favorite. I just learned this one. So apparently we should not be mentioning. So this is how it came about. I was speaking to, one of my colleagues, and they're like, well, what do you do when someone's not interested? I say, oh, hi, DC Health Link partnered up with us, and they said, no. No, don't say that. So that may be something that, what's the word? I guess stop people from trusting us. Turn out, okay, yeah, exactly, it's a turn off. So don't mention OSSI. More so mention, hey, DC government is providing XYZ. So it's all about our approach to the employees as well. So those are just some things we noticed or noted. Any questions about our pros and cons? Yes, sir.
I don't have a question about the pros and cons, but I do have a question about how we identify ourselves. So I'll say, hi, I'm TJ. I'm with Spaces in Action, but I'm also a grantee of, and then
Okay. That's what yeah.
outreach and engagement partner. Okay.
You don't have to let them know you're a grantee.
Okay.
But you know what? Now that we say this, when they're filling out the set more appointment, they will have to indicate grantee, yes or no. So I guess we will have to let them know that you're a grantee. We want to. OEP? Okay, well, let's do that. So can we go to, I just want to show you all. I'm going to show you all what's going to change. Did it change? Uh-oh. What's this stuff? Oh. He scared me. I'm trying to go to the set more appointment. Oh. So, okay, go forward one more. Let me move this down to the board. Yeah, one more. No, like next. Next. Where is, okay. So here, it says it, OEP grantee. So is that fine? Or should it just say outreach and engagement partner? Okay, so that's one of our takeaways, our action items is to update this to OEP, whatever, we'll update that. I couldn't get it out. Okay, yes. OEP partner. Okay, thank you all. So we'll update this section. This is where you enter the consumer's information for their appointment. All righty. So now let's just get into our role plan. Can I have my actor and actress? Okay.
In case y'all don't clap at the end. No, if you don't clap, I tickle you. Just so. Can we get another mic?
Thank you.
Our goal is to raise the floor. That's the buzzer?
Oh, that's the little the camera.
Oh, so he's talking into
This is the, what are they called?
the ring?
This is the ring.
Okay.
So
Should I get?
I was like, wait, what's going on?
This way? Oh, yeah, okay.
Okay. Okay, quiet. Oh, yeah, take one.
Action.
you need to tell you know she I don't sometimes I just don't know what she's doing. I don't know what she need to keep her mouth shut. That's damn. Hold on. Yes. Hello.
Hey, Jeff, it's LaDon.
Hello.
Jeff, it's LaDon. We had an appointment today at 1 o'clock.
Hold on one second. Miss Shamika, tell that. Get. Okay. Hold on. Yeah. Can I help you?
Yes, Jeff, it's LaDon from Space.
Yeah. How can I help you?
We have an appointment today at 1 o'clock.
We do.
Yes.
Hold on one second. Hold on.
Okay.
What time is she coming in? Can we reschedule this, Miss LaDonna? Because I got two people.
Do you
out.
have just 3 minutes I could talk to you for just a hot second?
What, can you?
Jeff, first I want to just thank you for all the things that you did to make the Homes and Heart Amendment pass.
Okay.
Because without you, what I'm about to tell you would not be.
Okay.
All right.
Okay. Go ahead.
So, Jeff, did you
Yes.
know that there's an opportunity for your
Yes.
staff and yourself to have health insurance?
Yeah, right.
That
Help.
is covered
Shit.
by DC
Hold
government.
on one second. Put the shit down. I swear to God, who I'm gonna smack the shit.
I know, right?
Okay.
Jeff, can I just, let me just Jeff, can I just have a moment of your time? I just want to
You on
ask
the other
you,
side
can
of
we
the door,
schedule?
honey. I haven't opened the door. I haven't opened the door. I haven't opened the door.
Oh,
Okay,
we
come
did have an
on.
appointment.
We,
Can we just, okay, let's just
sweet,
reschedule
we're
a
gonna have to
time.
reschedule this.
Say it again?
We're gonna have to reschedule. Can you give me another time, please?
Yes.
Please, we got 2 people out.
Can you give me your email address? I'll just send you an email when we reschedule.
Sure.
All right.
It's CEO_CERG at
Oh,
Comrush.
excellent. Yes, that's what I have right here. I'll send you an email. Thank you.
Perfect. Thank you very
Okay.
much. Thank you. Bye.
So that is actually what it's going to be like. You're just like, okay, 1 second. You'll hear kids screaming, hollering, one moment. They'll come back. I don't have time. I don't have time. Can you email me or just call me? And then what I try to do is, well, when are you available? Let me schedule your appointment. I'll already have the information. What day? Whatever day they tell me, I'll try to get them scheduled. And just send them an email. So, good luck when you come across people like Jeff. So let's give them a round of applause, y'all. All righty, on to you, Fumi.
Show offs. Okay, so so I am not the super host like Danica. I'm going to actually hand mine off to the team. We didn't give ourselves a name, so we're going to just say the best. So, if you don't mind.
I'm doing the pros and cons first.
Oh, we're cool. Thank God.
Hello, everybody. Hello. So I'm going to go over our pros and cons that we made. So for pros, we said education/reaching out. That is obviously a big pro of the outreach process, is that people will be educated, folks will be educated, and you also have a chance to reach out to these providers. Connection, so that trusted connection that you have with that person, which is why we are now here, it will be deepened because of, the outreach we are doing. Opportunity. So healthcare with childcare is an opportunity. It's a good one, we feel like, and we feel like that's definitely a pro to have on our list. Community trust. So we are all here because we're trusted community partners, and we feel like that information about this program is only going to further that trust along. And then alliance. So we talked about how healthcare for child here, DC HealthLink is kind of coming with an alliance or have allies, and we are the allies, the trusted community organizations and partners. And for cons, we talked about nerves. So nerves for yourself and nerves for the other person. Timing. So similar to what happened with Jeff and LaDawn, sometimes the time may not be right and folks may not be available. You have to reschedule. Numbers. We said we said numbers being a con because this program is already we're stepping in the middle kind of and trying to pick up the pieces, which is one kind of con that we had as to, even though that healthcare for child care is 90% implemented and it's pretty far along, it's still work that needs to be done. And then for cons we said unaware/education. So for folks who are not who aren't aware of this program, that's obviously a con. And then we said DC government being a con and a pro because a pro being that obviously if it's something that's being done by DC government, it's legal and it's right and it's can be happen and there's money behind it and things. However, the con being a lot of the the lack of trust between centers, family homes, and DC government, specifically Aussie. And so isolation was a con that we had because some centers and family homes may be isolated in this process and maybe not part of certain groups or spaces to hear about this opportunity. And so we said isolation is a con that we're going to have to seek some people out and find them. Anything else, team, that I missed? Now it's acting time.
All right, so this was our idea of how a general pitch would probably go based on the information we had here today. Basically, we were going to walk up and, to our preset appointments, be like, hey, we are an outreach and engagement partner for DC HealthLink. I'm a representative from the Community Educational Research Group. We do a lot of similar work here in Ward 7 and 8 or wherever we are. But the question that we wanted to lead off with was, well, have you heard of healthcare for childcare? No. And no, I haven't. Well, I'm not asking you yet. I'm telling them about this, all right? And we figured from that, like, you either get a yes or a no, right? So if you get yes, it's like, well, why haven't you signed up yet? Like, is there a reason for that? And, there are 4 basic ideas where either, DC City mistrust, which we kind of mentioned, federal program mistrust, concern for undocumented employees, or you just don't need it or want it. And then the yes is, well, here's the pitch deck for that, right? So, okay. Yes? No.
No, I haven't heard of healthcare for childcare. What is that?
Okay, so healthcare for childcare provides free or reduced health insurance through the DC Health
You
Plan.
said free?
Or reduced.
Okay.
Health insurance for employees of licensed childcare development centers here in the district.
Okay. So license meaning like Aussie and them, like we license underneath of them?
Aussie
okay,
license,
okay.
yes.
Okay, and so what does healthcare for childcare do?
Healthcare for childcare gives you a subsidy that makes either your current plan less expensive, based on the subsidy you get to continue it, or it gives you healthcare for a very reasonable rate in the instance that you didn't have it before.
Okay. And that's an example somebody doesn't know, so now I know.
Are you worried about your undocumented employees?
Yes, definitely.
So I have assurances that any information you give to DC HealthLink for the sake of getting coverage for undocumented employees isn't shared with any other federal or city agency. There is a veil there. So
Okay.
It'd be great to have a more articulate pitch for this particular scenario and all other 4. This is just what I have here. All right. Anything else?
No, that's it. I think. So what's our next steps?
So I'm
interested in getting this for my center. So what are our next steps?
I'd love to set up an appointment for you and one of our registers. Is that it? Registers? I actually have a QR code right here for making an appointment. It goes directly to the DC HealthLink website. It's right here on the back of my name
The
badge.
QR code, ain't that when you put my phone up and I take a picture?
Exactly what it is.
Okay.
Or you know what? I can text it right to you, the link, if you prefer.
Yeah, you got text it to me.
Okay. Yeah, I have my phone right here, so we're all set.
Okay.
Cool.
There's a question about the federal government. We are not federally funded. If you ever ask the question about, is this a federal program, DC HealthLink is funded through an assessment from the providers. Okay. Yes, you did, because I told y'all who providers were, right? So y'all remember, don't you? Okay, all right. Look at Maurice. So we assess them every year. And from that assessment is the budget that we work off. We get no money from DC government, no money from the federal government. That's why it's called a public-private partnership. The Health Benefit Exchange is a public-private partnership. And so we have a board that we report to. We don't report to the mayor. We don't report to the city council, although we got to work with them. But it is a public-private partnership, and that's what that means. So if they ever ask, we are not federally funded at all, okay? We're federally connected, but not funded.
No, I was just clarifying because I thought I saw some puzzlement about provider. It's Care First, Aetna, United, Kaiser Permanente. They are assessed a fee for us to, because we're showing people, hey, if you want to buy insurance through here, you have to come to our website, right? And so they're assessed a fee every year, and that's where the funding comes from. Jeff?
I thought part of the money came from the pay equity and the tax on
That's
people
the
making
healthcare for childcare program, but we're just talking about
the
DC.
whole thing. Oh, okay.
DC,
okay.
HBX, DC HealthLink as a whole.
Okay.
The reason our salaries are paid are from an assessment.
Yeah, and the money that we get from the pay equity fund is exclusively for the payment of premiums. That does not pay our salaries. It does not pay your grant. That is all on the assessment.
Oh. And it's not even paying this grantee program, right?
Right.
This is,
yeah.
I wanted to add something. When we get to the point of scheduling an appointment, I highly suggest we schedule the appointment unless they're just pushed for time and they're not able to schedule. Because what will happen is they'll just get back to their day and they'll forget. Or they might place the card somewhere. When you're around kids a lot, you clean up a lot. I know that I have my cousins for the summer, so I'm like just throwing things away all the time. So definitely the first step is to schedule an appointment yourself for them. And then if they don't have time, then we'll just say, okay, hey, here's a QR code, or I'll send you an email so you can get yourself set up. Thank you.
Okay, so we were talking about the pros and cons of going out to see these centers and their employees. And the cons we talked about were what it's going to be like engaging employees that maybe newly lost their Medicaid. They're not used to paying for anything at all, not understanding what premiums or deductibles, copays, things like that. Just having to engage these employees. The other thing is employers that have never had to administrate coverage before. They don't know what they're doing. They're apprehensive, nervous about doing it at all. And the follow-ups. They said follow-ups would be a con. Just having to go back over and over and to try to get someone to listen to you about the program. So those are the cons that we came up with. The pros is being able to receive benefits that they never before had access to, that they couldn't afford, with some employees that have ongoing health issues. We have a lot of stories like that, actually. That's a huge pro. Employers, they now can offer coverage that they could not afford to do before. It also allows them to offer benefits to the employees' dependents that they couldn't do before without the discount. So there's another pro. We had a lot more conversation. It's just not documented here, but you're gonna do. What scenario are you guys gonna do? All right. So I don't think we're prepared for this. Yeah. Do we have to do a scenario? Okay. We had some deep discussions over here. Yeah. Yes. Yeah. Sorry about that.
So thank you all for joining, just participating in the Warm Handoff process. And we really liked your scenarios. Next time, tomorrow maybe, we're going to get y'all. They're not off the hook. But just want to thank you all for joining us today. We're going over everything. We've pretty much touched base on everything. I'm just going to look at the agenda. So today we did our opening session. Thank you, Linda, for everything. And I wish Lori was still here, but I really enjoyed the icebreaker, getting to know you all. My fellow Pisces, India, she's gone, but was happy to work with her. We then went over the Healthcare for Childcare program, eligibility, and just an overview of the program. How can someone get enrolled in SHOP versus IVL? We understand continuing coverage, right? So the process is the director is going to sign up for SHOP if they have non-DC residents. We'll take their DC residents and take them to the individual and families market. If the group already offers coverage, what program do we have? SHOP. And then what is the specific program they'll participate in so that they can maintain offering the coverage they have? Yes. Yep, exactly. So SHOP, and then we have that subcategory of continuation coverage where non-DC residents and DC residents will all enroll in SHOP. Those DC residents who enroll in SHOP are automatically ineligible for the individual and family market because they have the SHOP coverage. For our large employers with more than 100 full-time equivalent employees, can they enroll in SHOP? No, why not? Okay, so, yeah. So I just wanted to see, so yeah, there's a limit. So if you have more than 100 full-time equivalent employees, you cannot come through the SHOP marketplace. However, can their DC residents? Can a DC residents come through the individual and family market? Yes. So what happens with their non-DC residents? Look at that. That's what I'm talking about. So for the non-DC residents, hey, maintain your employer-sponsored coverage. or go to your state exchange for help with coverage. So yes, thank you. Do we have any questions?
Okay. Again, we want to thank you for your participation today. A few house cleaning things. Tomorrow, if you wear your T-shirts, we're trying to do a group picture of our Army. So you don't have to wear your fatigues tomorrow, but we want to show them the grantee Army. But wear your T-shirts tomorrow. Somebody was asking me, should they wear jeans, should they wear pants? I'm interested in the top part of you, so whatever. The bottom part is on you. We also will be doing headshots tomorrow. I didn't do it today because I know people say, you didn't tell me, I didn't bring my lipstick, I didn't bring my this, I didn't bring my that. Tomorrow we are doing headshots first thing in the morning because we need those headshots to go on the ID badge, okay? So that's from the neck up, okay? And then the boxes, I want to remind you of the boxes outside. If you didn't come prepared to take that big box with you, we'll have it stored here today and you can get it tomorrow. The list of the centers that are assigned to each grantees, we will also email, but we'll have that list tomorrow for you as well, the list. And it also will be emailed. And did everybody do the sign-in sheet? Because I have different names that I was sent in an email and then who's actually in the program. So we don't want to print out the wrong name badge and the wrong face with the wrong name and all of that. So we need to get that straight. Yeah, I got your email. But if there were any changes, just let me know because the badges and stuff will be printed with the names that we see here today. Is there anybody that's not here today that will be here tomorrow? I'm asking the grantee directors. Jeff, anybody from your group? Hakeem, no. Dawn, no. Oh, right on that piece of paper, because she's got to do the name tags. Okay. Okay. Is there anything that we need to cover or recover for you tomorrow? This is up. We can make adjustments in our schedule. Is there anything that you need to know that we don't have? Yes, sir.
I know you guys had talked about a training coming up, just on like the language that we'll be using and things like that. Can you say when that date is again?
The health literacy work, that's July 12th.
July 12th, okay.
That's July 12th. It's in this building, but it's on the 4th floor in the conference center.
Okay.
It's on the 4th floor of the conference center.
Thank you.
Any other questions? Okay, let's hear from you. How did we do today? I mean, be truthful. What do we need to do better? What we do? You raising your hand? She's got. That's my broker. Oh, okay. That's our OE broker, y'all. That's our broker there.
Sorry, you did well. This is a great event. I do feel like.
Shh, can you be quiet over there? Thank you.
We might be able to streamline some of the breaks. Just get out here a little bit sooner. We maybe do 2 breaks, but it was a good event, and thank you.
Thank you. Anybody else? Very good.
Very informative.
Great.
Here. Can we go?
They're still talking. Anybody else? Anything we can do better for you tomorrow? On tomorrow? Anything we were missing today that you should have tomorrow? Okay, so it's July 12th. Put that on your calendar for the health literacy workshop. That will be the first in a series of workshops. We'll have another one in September, but for sure, on July 12th, here on the 4th floor, we will have that health literacy workshop. Okay, if all hearts and minds are clear, as they say in the Baptist church, let's pass the plate. No, I was just kidding. Okay, again, we want to thank you for showing up today, and we are looking forward to what will happen as a result of you being here. Thank you so much, and we let out early, so give my staff a hand clap for getting out early.